All right, today we're going to play medical detective. In our case, it's a really common but super misunderstood condition, one where our body is practically screaming at us with clues if we just know how to listen. So let's grab our magnifying glass and start with the very first piece of the puzzle.
You know, it all kicks off with something we've probably all heard since we were little kids, right? Eat your carrots, they're good for your eyes. But have you ever stopped to ask why? What's the deal with carrots? Well, that simple piece of advice, it's our way into a much bigger story about a nutrient that's doing a whole lot more than just helping us see in the dark.
Okay, so our investigation starts with the very first clue. I want you to picture this. The sun's going down, the world is shifting into that beautiful twilight. But for you, as the light fades, your vision fades right along with it. It's a weird, kind of unsettling feeling, right? Well, that is your body's first major warning sign that a really important system is starting to fail.
Now, this isn't just a matter of, oh, I probably need new glasses. No, this is something specific. It's called night blindness, or if you want to get technical, nyctalopia. You can think of it as your body's first super urgent fire alarm going off, telling you that a critical component for your vision has gone missing.
So, what's the missing piece of the puzzle here? You know, the mystery isn't about some kind of villain attacking the body. It's actually about a hero that's vanished. The real culprit behind that fading vision, it's the absence of one crucial nutrient, vitamin A.
Okay, so let's put this hero, vitamin A, under the microscope. It's also known as retinol, and it's what we call a fat-soluble vitamin. Now, I want you to remember that phrase, fat-soluble, because it is the absolute secret key to this whole entire mystery. Its main job is basically to keep our vision sharp, our immune system locked and loaded, and all of our body's protective surfaces in tip-top shape.
You can really think of vitamin A as the body's ultimate, all-in-one maintenance worker and security guard. It's the powerhouse behind our eyes' ability to adjust and see when the lights are low. It's also in charge of maintaining the integrity of our skin, the linings of our gut and our lungs. It's like a biological brick wall. And on top of all that, it reinforces our immune system, which is our body's very first line of defense against invaders.
So if this vitamin is so incredibly important, how does it just go missing? Why would someone not have enough of it? Let's dig into the next phase of our investigation here and uncover the reasons, the motives, if you want to stick with our detective theme, for why a deficiency might happen in the first place.
And this is where it gets really interesting when you break down the causes. I mean, sure, on a global scale, just not getting enough vitamin A in your diet is the biggest piece of the pie. But look at this. A full 30% of cases have nothing to do with what you're eating. Instead, they're tied to other medical issues, things like problems absorbing fat or chronic liver disease, which messes with how the vitamin gets stored.
So let's drill down on that malabsorption problem for a second. We're talking about conditions like celiac disease or cystic fibrosis. These can totally prevent the body from properly absorbing fats from your food. And remember what we said? Vitamin A is fat-soluble. So if the fat can't get into your system, guess what? Neither can the vitamin. It's as simple as that. And it's also worth noting that heavy alcohol use can throw a wrench in the works too, messing up both storage and absorption.
This right here, this is probably the most crucial and kind of counterintuitive point of our whole investigation. Get this, you could be eating all the carrots and sweet potatoes in the world, foods loaded with vitamin A, but if you're on a super strict, very low-fat diet, your body has literally no way to absorb it. The vitamin needs fat to act as its Uber, its transport vehicle. And if that vehicle never shows up, the vitamin A is just left stranded on the side of the road.
Okay, so as this deficiency gets worse, the body doesn't stay quiet. It starts sending out more and more signals. It gets louder. That night blindness, that was just the first whisper. Now, we've got to learn how to read the whole range of clues the body is giving us, from head to toe.
The clues coming from the eyes, well, they start to get really urgent. It kicks off with that night blindness we talked about. But then, it can progress to something called xerophthalmia, which is just a fancy way of saying severely dry eyes. And if that is left unchecked, it can lead to keratomalacia, where the cornea itself actually starts to soften and erode. We're talking a serious risk of permanent blindness. The stakes here are incredibly high.
But the clues don't just stop at the eyes. No way. When our maintenance worker vitamin stops showing up for its shifts, the body's whole infrastructure starts to crumble. You might see things like dry, rough skin, or even something called follicular hyperkeratosis, those little bumps on the skin. You might even see hair loss. And remember that biological brick wall? Well, when it gets weakened, you're suddenly wide open to more and more infections.
So let's connect all the dots. Imagine a classic case. A patient comes in and they're complaining about two things. Their night vision is getting worse and they've noticed new hair loss.
So the doctor starts asking questions, doing some detective work, and they uncovered the final, crucial clue. For the past 3 months, the patient has been on a really strict, fat-free diet for rapid weight loss. And boom, suddenly all the pieces of the puzzle just click into place.
All right, so the evidence has been gathered. The culprit, the deficiency, has been identified. It's time for the final act, solving the case. How do doctors actually confirm the diagnosis? And more importantly, how do we get our hero, vitamin A, back where it belongs?
Now, this is a really important point. Of course, there are lab tests you can run, but a lot of the time, solving this particular case comes down to good old-fashioned detective work. A doctor has to piece together all the evidence, the patient's history, what they've been eating, the physical signs they're seeing. It's the full story that the patient tells that often ends up being the key that cracks the whole case wide open.
Once that diagnosis is locked in, the plan to fix it is pretty straightforward. Step 1, you've got to replace the missing vitamin, right? Stop the immediate damage. But, and this is so important, you have to address the underlying cause. Just throwing vitamin A at the problem isn't going to work if there's a malabsorption issue. That's just going to block it again. After that, it's all about counseling on diet, vitamin-rich foods and those healthy fats, and then just monitoring to make sure the symptoms are getting better and our hero's back on the job.
And with that, case closed. We've seen how the absence of just one single unsung hero can send these dangerous ripples all through the body. And it really leaves us with one last big question to think about, doesn't it? If one vitamin can be this critical, what other hidden deficiencies, what other secret stories might be impacting our own health every single day?